But how can we prevent and empower African communities, especially East African, to speak up? And what I mean is to make awareness about HIV, that they don't have to feel stigma or shame. This is something is going on, and they need help, and they need to seek for help to save themselves. And how can we prevent that stigma and shame in our community?
So that's the question. How can we answer that?
The fear is when people come out and declare that they are positive, then it will be everywhere, everybody will be talking about it, but we are not going to get help. So if we can convince them that there is a group of people or an office where they can go to and get help, and they are not going to be publicized, I think they're going to feel more confident to come out and talk about it.
But the best thing that we can do is to educate people and tell them that AIDS is just like any other disease that you can get. And this AIDS can also be treated, and it can extend your life. You know, some tribes in Africa, if you get that, they will say that you are cursed. So that's why people keep it to themselves. But if you take it as if this is a disease that's just like any other disease that can come to yourself, and you seek help from doctors, from people who can advise you, you can live much longer than you can live.
I think it's also all about courage and believe in yourself. This is not something you want to have. This is a disease, and it happens. Like Brenda, speak up and have the confidence that reach out to other people. You know what you're going through, and you need to go out there and reach out and talk to other people and tell them, educate. It's all about education and knowledge.
Okay, I'm gonna put mine to begin a question. So we are more right now talking about people coming out to the open and talking about it. So how do they know that they have AIDS before they can talk about it? So I know, like in Kenya, recently they have stations that are called voluntary testing and counseling. So do they have anything like that here that they can, and then there is also the high risk groups and people that are not high risk. So high risk people maybe, or maybe even just anyone can go to those voluntary counseling and testing centers to be tested, because it has to start there so that if you know you're positive, then you can talk about it and seek help. So they need to first of all know, somebody needs to know, am I positive or not? Am I high risk or not? Or have I been exposed or not?
There are people who are really, really reluctant because of the cost that may be involved.
So what do you think of this side? We're not getting anything. This side is very good. What's the side? About what has been said?
I just made a point, like, we don't need to educate just those ones who are positive. We need to educate basically everybody, whether you have it or not. So just for example, if I don't have it and I find a friend or a relative who has AIDS, HIV, how do I also need to be educated on how to go about helping this person, not just the people who are positive. So I think basically everybody needs to be educated or informed.
Does anyone know in the room where you can go to get a free HIV test? Public health.
We know we can go to public health centers, but we come from different locations.
Right.
So to know the one that is closer to somebody's zip code is much better than just knowing that in a public health clinic you can go. But do I know whether there is one that is near me in Brighton, which one is in Federal Way that I can go or Tacoma?
And then you have your doctors, no? Some of you, some don't. Some don't.
So many people who belong to churches can respond maybe if the pastor says that we're going to invite people from public health or somewhere else to come and give a speech about HIV or something else. I think pastors are able to mobilize people easier because they identify with the church. But if you tell them to go somewhere that sounds strange to them or sounds threatening because of many reasons, they don't feel confident. but if we make it on a church base, it's likely to get more people because I know people feel more closer to the church than any other organizations.
So, is any of you, like in your church, is there any conversation regarding HIV in any of your churches that you go? There is.
Yeah.
So, Bibians, there is where people.
I think it's because I think that the face of HIV has really changed over the last 10, 15 to 20 years. There used to be this association of getting HIV, AIDS, and then people assume it's a death sentence. That's not the case anymore. People are living long, full lives with HIV, so long as they get treatment on time. And I think making people aware that HIV is still really present, I think people have kind of forgotten that. If you're not in the healthcare profession or something like that, you don't see the prevalence as much as it used to be before. I don't know if you agree with me, but that's what I see. So when I have these discussions with people, especially people with either high-risk communities and things like that, I try to get tested, but that doesn't always, we can't always rely on the church to take care of everything. I think personally, we have to be comfortable enough to say, and this is real, this is still going on in our communities, and people still need to get tested, and also knowing where to send people, it's not enough to have it, is a good step. Where are the free clinics and everything like that, so you can point to people, this is where you can go and get tested and then find treatment for that.
Okay, having resources is a good thing, but I think also just being okay with having conversations about HIV between friends and communities and churches and things like that, I think will be a good step for people to get more comfortable about discussing it without having to feel that it's something that is, taboo. And then once they can have the conversation, then you can point them to where they can get resources to help for support groups or medical care and things like that. Yeah, but I think people have to be comfortable enough to talk about it first.
I'm HIV positive. I was diagnosed with HIV in 2007. Before I was diagnosed, I didn't talk about it. I didn't think about it. I just pushed it out of my mind as if it did not exist. And then when I was diagnosed, it became my life. I'm a peer advocate. I work with other HIV positive women, providing peer support and directing them to the right resources. How do we initiate that conversation if someone isn't already positive or doesn't have someone in their life that is positive?
That's a good question. So how do we initiate that conversation?
Kila siku minaumia na mawazo, wapi nitapata mke mwema maishani, akinifuta machozi nikasahau nilipotendwa zamani. Naona kama ngekewa mtoto mzuri kuwa nami maishani, nachomwambia ananielewa, napenda sitomwacha silani. Gari pesa sina, ndio maana nakuiriza mchumba, wewe gari na nyumba ama pesa ndo chumba, bora unirize mchumba. Gari pesa sina, ndio maana nakuiriza mchumba, wewe gari na nyumba ama pesa ndo chumba, bora unirize mchumba. Mimi si mgeni wa mapenzi mwenzako, maumivu na yatambua, nipende kupende wewe ishara ya upendo, haiwezekani wewe date unanisingua. Mimi si mgeni wa mapenzi mwenzako, maumivu na yatambua, nipende kupende wewe ishara ya upendo, haiwezekani wewe date unanisingua.